say, this is the science around the coronavirus. The myths about cures, which I found have been the most, that Africans are immune, because initially when it started with China and going to Europe, there was no Africans or people of African descent suffering from the disease. So that is where we really started speculating more about what was happening in the north, and very little here. Then after that, when we reported the first cases in Africa, then it started becoming an issue of could we not? And we were seeing the issues. I think the most prominent was a whistleblower from the BCIA about this, and it started sort of sinking in that this thing is a real threat. It could be here with us anytime. Then when we reported this particular disease, now it was like, okay, I think for the first weekend we were in shock, unsure of what this actually meant. There were so many questions around it, but I think the most significant of it, even from my own end, was what next? And there was a lot of, from the what next, who will do this, what next, what is required. There was a lot of uncertainty, especially about that weekend. And then obviously things now started falling into place, where now there were these measures that were being announced, and you find yourself at a point where you have to pour into these measures. What are they? Do they work? What have other countries done? What can it work here? Can we modify? What does it mean? What about social protection? So there was a lot of issues now around the measures that are being instituted. And from the front line now, I found myself looking for the same information like everyone else, trying to understand, and at the same time being required to sort of communicate this to the wider public and to my colleagues around. So there was now that period of what are these measures and what does it mean? And then we sort of settled and people started coming in, and now we were at the numbers. Then the issue has been, okay, so what do these numbers mean? If we announce 4 people have turned positive, or another day we are saying 22 people have turned positive, what does it mean? So I've found myself most of the time having to learn along the way and learn very fast, because you are required to relay the same information to the public. And before it even goes to the public, part of the public starts with my colleagues in the newsroom, because those are like the first audience. Because when numbers are increased, then when numbers are announced, for example, that's the time when my phone is the busiest, because people are like, okay, so Daktari, what does this mean? Are we doing badly? Are we doing well? So it's been a roller coaster, if you ask me. So it's been now the numbers, and now where we are now, I find myself now in a position where we're like, okay, what are these numbers? Who are the people behind the numbers? We need to see, because sort of we need to be alive to the fact that this disease is here. Most people don't actually believe, for a good number of people, because I still get people asking, is this thing really here? How come I don't know anyone who's gotten it? Are these measures just an exaggeration from government? So I find now we are at a phase where we have to sort of now start telling stories of who these people are and what do these stories mean. And now, apart from the people themselves, now there's also the medical experts. Yes, there are people, but there are a special group of people in that where I sit, and from what I see is that these particular people, if a doctor or let's say a nurse contract the disease, it means we in the community have contracted that disease, because they come back to us. They are in a high risk place, and if they contract the disease, they come back to us, and it becomes a societal problem. So we find ourselves where you have now to prioritize or to balance between telling the story of the kawaida person, the you and I, and telling the story of the healthcare workers. And this poses a challenge, because now when we talk about inadequate PPEs or lack of personal protective equipment, or we are talking about poor working conditions, it means you need to go there. And then now you have to ask yourself, is it safe? can I be safe enough to go and tell this particular story? So now that for me has been the journey or this front line to where we are now. And looking ahead, I see a situation where now we have to even go further and probe and hold people's feet to the fire, hold them accountable, and ask questions about what is happening, what is the strategy that we have as a country. If we are spending money, are we spending it in the right place? Are we going back to what this country used to, where there's a lot of public funds? So there's a lot looking ahead. We really have to now get to the thick of things and start probing more, because now sort of all the way to now we need a way out of this particular pandemic, and that way out of it means we have to hold certain people accountable. So that for me has been the long and short of this frontline reporting for the coronavirus.
Yeah, she's spoken. We need to take it on UK.
Okay, thank you. Thank you, Mercy, Dr. Korir. Thank you so much for those introductory insights. And now we're going to hand over to Asha Mwilu to give her presentation. Asha, please.
Yes, thank you. I was trying to unmute myself. Thank you, Njosi. Hi, Mercy, and everyone else. It's good to see you all, and I'm really happy to be doing this. Just glad to be taking a break and talking about sort of like looking back at what we've been doing. For me, covering coronavirus happened very strangely, because by the time we were reporting our first case, or by the time Kenya was discussing whether or not we have our first COVID case, I was covering what I thought was the biggest story in Kenya at that time, and that was the locust story. So I just come back from Isiolo, and I had done this documentary, 30-minute documentary about the desert locust. That was March 8th. Then March 13th, we report our first case. So I definitely saw from the very onset, especially with how unprepared we seemed, how aloof government seemed at that point, that this could escalate to be a really big story. And obviously in the whole world, it already was. So for me, the approach I took was to actually just go with my instincts as a journalist. I'm not primarily a health reporter, I'm primarily an investigative reporter, although I do cover very many bits. So for me, I thought, let me listen to what people are saying and just try to sort of like flow with the questions that I imagine from the public. At that time, when I was doing my first report, government was encouraging people maintain social distancing. We had around 3 cases at the time. And I just remember sitting in the newsroom one morning and just thinking to myself, what is the most crowded place I can think of in Nairobi? And that is Gikomba, right at the entrance of Gikomba, where we also have the Machakos bus terminus. And I thought to myself, wow, I wonder what social distancing looks like in such a place. And that was sort of like my first plunge into this story on coronavirus. And when I went to Gikomba, I mean, it was very apparent. My instincts were right that it was quite impossible for people to maintain social distancing in that place. In fact, to the Kenyans that I spoke to there, COVID-19 was so far from them. It was still a very elitist problem. The perception was that I haven't traveled, because at that time, the case definition for someone who was at risk of COVID-19 was someone who had recently traveled abroad, or you were sort of like close to someone who was out of the country. And to them, they just were not at risk. They didn't understand a lot about this disease. I did that first report, and the following day, Gikomba Corona was trending online just because of the reality. I saw a couple of men sharing one cup. This is not even just about maintaining distance. Some people, as is the norm in most of our marketplaces, there's one place where there was a running tap. People were not washing hands. Instead, they were drinking water, and they were sharing one green cup, and that came out in my report. So it's at that point that I actually realized that the way we are understanding this story, the way we are understanding coronavirus, it's very unique. It's unlike the West. The things that people were discussing online, that our realities are very different, were now becoming more and more apparent to me. That social distancing, for example, is not, it's a luxury for a lot of us. So I sort of took the route to, instead of, doing what I usually do, which is like follow government, hold them to account, was to now go into communities and try and seek expert opinions and try to understand COVID-19 for myself so that I can explain it to the audience. So after the Gikomba Corona story, one thing that was coming out was about the testing. I wanted to understand, how are we doing testing? What does this testing look like? You remember Italy was now having really its worst, and everyone was talking about the US, and the reason why the US at that time was not having very many, they couldn't trace all their contacts, was also because of a testing issue. They couldn't test as many people as they wanted at that time, and Italy was advising them, look, you need to test. So I wondered, what does testing look like for Kenyans? The unfortunate thing is that, at the same time, health officials at the Ministry of Health were also just trying to grapple with the reality of this story. They were trying to grapple with the reality of COVID, grappling with setting up testing centers. Who do we test? Where do we get them? And I was lucky that at least the private facilities like Aga Khan Hospital were very, very open to discussing this. And a lot of times such facilities are not very open to discussing, medical issues and their processes, especially in such a quickly evolving story. So Aga Khan was able to allow me to go and see how they were doing the testing. I now started to understand, and I showed the audience in my story just a step by step. So my approach was really, come with me as members of the audience. I am also trying to understand this thing. I don't know much about it, so come with me and let me just unravel the layers of this story bit by bit. So I did the testing story at Aga Khan. We saw what they were doing at that point. So people were asking, should I get tested? And we're able to answer some of those questions. Now, the more I was doing the stories about the community and about the science of COVID, I also realized the complexities that were emerging. So when we were talking about testing, and I was trying to get interviews from government officials or from Ministry of Health, there were, I could see how complex the situation was for them, because even for them, they could not test, especially in counties that were very far from Nairobi. So you remember at that time when we had the first 8 patients, one of those patients was the Kilifi deputy governor. And everyone was talking about, look, this person went to so many places. He must have exposed so many people. So another question then popped in my head, and I wondered, I was just talking to my editors, and I wondered, why don't we try and trace where the Kilifi deputy governor was? Luckily, again, the Kilifi governor, who at the time was also in quarantine himself because he had come into contact with his deputy, agreed to give us an interview. And it's actually from him that now we were able to map what he knew were the last steps, the last points of convergence that his deputy had. And that's now, in my mind, I began to see how big a problem that we might have been dealing with at that time, because the Kilifi deputy governor had gone to 3 burials as soon as he had arrived in the country. I asked the governor at that time, when he was in quarantine, I asked him, do you know how many people in Kilifi at those 3 burials? Do you know how many people the deputy governor came into contact with? And his answer was, the deputy governor could only account for 20 contacts, because as you know, most of the time in burials, you have very many people congregating. And for a leader such as the deputy governor, you'd hardly remember who you've come into contact with, because everyone wants to come to you and greet you and say, deputy governor, how are you? So he couldn't actually remember all his contacts. But beyond that, he'd gone to a hotel in Mombasa, then he'd gone to Mombasa Hospital, he'd gone to the county assembly offices in Mombasa. So that's just painting that picture of the viral chain of infections. We had already heard about patient 31 in Korir. So I did that story about, could the Kilifi deputy governor be patient 31, our patient 31. But I think, as Matthew said, it's just been such a learning process that as you go along, you also try to get feedback from people. And for this story, more than any other, because we've been covering one story every single day for the past 1 month, for this story, more than any other, I have been scouring my comments on social media, on Twitter, every time I post my story, because I've seen that people are actually asking a lot of genuine questions, and some of those questions then feed into the next story that that I look out for. Because then when I would post my stories on Twitter, I would see people now reaching out and telling me, look, there are other aspects of this story that are not being covered. For example, the situation at the mandatory quarantine sites where government had taken people who had recently traveled. And so then that became something that I wanted to dig into, and my investigative instincts now started to keep the mandatory quarantine out in contact of people who were at KMTC, the Kenya Medical Training College, and just told them, this is just one of the interesting things that I found about covering this story, that I'm unable to access some of those places. So it's also telling people, look, just take your mobile phone, film the most, what you would think is a very obvious thing. I told them, just go with your mobile phone, film the toilets. They would tell me we're sharing bathrooms. So I said, just walk about, just sort of like you're creating your own vlog, and film for me the bathroom, film for me the showers, film for me your room. Let me see how you're living. And very brave Kenyans accepted to do that, and they filmed for me people who are at different hotels, and sent me the footage. And that now, together with what other journalists were covering from other media houses, became another point of conversation. Did we mishandle this process from the very beginning, even with how we handled the people who were in mandatory quarantine? So I think that's basically how I've approached this story. It's very instinctive. It's through conversations with people, even just calling my family members and asking them, what do you guys understand about this story? And realizing that, for a lot of us, even the most educated, the most elite, people had the same questions, because we've never seen something like this. And I think my last report now was this past Sunday, when I got to speak to the first patient who left ICU. And I think for me, for the journalists who I guess might be watching this, it was very surreal. I don't feel like I've done an interview like that before, where you're interviewing someone who you knew was infected. You're covering this interview in a hospital. You're wondering whether you should be in a PPE. There's not enough scientific evidence, but what the evidence we have right now is that if someone has tested negative, they're unable to pass the virus to you. And then also thinking about the sensitivities of interviewing a patient like this who just underwent a very traumatic experience, but says they really want to share their experience with the rest of the country, just to show that, look, it's not all doom and gloom. I've been through the worst of it all, and it's important for people to listen to this. And just for me, thinking to myself, actually, this is a really crucial story, and I should take precaution, but it's very important that I cover it. So I think I've covered sort of like the baseline of how I've covered this story so far. And yeah, I'm happy to answer any questions that people might have for me. Jyoti.
She's on mute.
Dr. Korir, can you see it?
Yeah, now I couldn't hear anything. Now I can hear you. I can't hear you. You're on mute.
Okay. Dr. Korir, the question is, what are your thoughts on patients' privacy in regards to flattening the curve? Would sharing more details on the positive cases help with contact tracing?
Well, definitely. If we knew, like we knew the deputy governor, for example, or we know patient zero, Brenda, if we have names to these patient numbers, definitely to help in contact tracing, in being able to contain the disease. But here is the catch, where the decision for somebody to come out and give their information. Remember, this is a personal disease at the end
This
of
video,
the day.
not that one.
It's a personal disease. So it's a person's choice to come out and say, you see, I was diagnosed with the coronavirus and this is my experience. So that is left to the individual person. We don't expect that the government or the Ministry of Health or people will come out and say, so and so are the people who were found as positive. That would be an outright violation of privacy. What is done behind the scenes and what is contact tracing is that this particular person then has to like sort of even write a statement of everyone that they remember they have met. And it's from there that now officials, the Ministry of Health officials go out and look and find out who these people are. So in terms of contact tracing, that is how contact tracing works. If we knew who and who has been diagnosed, definitely to make contact tracing easier. But that is left to the prerogative of the individual. If you are to put yourself in the shoes of these particular people, you would want that to be your decision to make, to come out and say, you know, I have coronavirus. Then the other thing that we are grappling with, and is a story that we have not told well, is the stigma. Because I have talked to even my colleagues who have been diagnosed, the medics, the doctors and the nurses, the clinical officers, those who are in quarantine, or those even who've been suspected, some of the patients who have been discharged, and they are afraid of coming out because even the moment that they went back home and said, I had been in isolation, or people knew they were in isolation for coronavirus, then the neighbors don't want to associate with them anymore. So you can imagine if this is made public, then we will have a whole problem of stigmatization. So we probably need to start sorting out stigma first and assuring the people that we talk to, the people who will come out, that, you know, once somebody has healed, they are okay. You do not have to fear them, you do not have to stigmatize. So there are those two issues, the privacy issue and the issue of stigmatization, which we all in society are guilty of, because we still have a lot unknown about this disease and a lot of fears. And unfortunately, we express our fears by stigmatizing certain people. And this, as you've seen, many people have compared the coronavirus pandemic and how it's evolving with how HIV was when it started early on. Like before HIV became a norm, quote unquote, it took very many years. And still, even now, we still have pockets of people who still stigmatize. So we are still a very long way away from people genuinely and comfortably coming out to say, you know, I have coronavirus. But coming in from our public authorities, we do not expect that to happen.
Great. Interesting.
Yeah.
All right. So there's a question here from Harry Betts to Asha Mwilu. How do we balance between getting updates and all the fear-laden messages from journalists on COVID-19 and maintaining our sobriety? There's a lot of information flying around. So Asha, how do we sort of strike the balance between getting these updates, all the fear-laden messages from journalists on COVID-19, and also maintaining our sobriety as a society, you know, staying sane?
She's on mute.
Asha, you're on mute.
Yeah, yes. So I think my answer to that is that this is one story that like heavily relies on science and heavily relies on facts. And I think that's one way to sort of like balance out the fear. It's that to give the reality. So if the experts are saying that this is what we should look out for, this is what we should expect, then that's what we should balance. And I understand why, Harry would be asking that question, because you sometimes do listen to the tone of the health minister giving updates, and we do wonder ourselves as journalists in the newsroom whether the tone is a bit too alarmist or not. But I would say relying on the science, but also it's a story that you just need to give people like a proper dose of reality. It is true that we're still seeing people going out on the streets and parking their cars and partying on the road and feeling like this thing is really too far away from them. We have seen people being arrested from their homes, holding birthday parties, not maintaining any social distancing. So while we have to definitely make sure that fear is not what drives the narrative, what drives the reporting, it's more about the reality check. And as I said, I just think the science is what could help, because for me, what I've done is to look at and to look at also what's happening in other countries, doing that comparison, looking at the data. So it's to show that this is actually how contact tracing was even done in areas that had Ebola cases, for example. This is how quickly a virus like coronavirus can spread in an area like ours. So balancing or using science to see whether we can validate the tone that government is using for this story. And if we can't, it's to also hold them accountable. And I like what people like Dr. Korir are doing, because I haven't been going for the briefings, for the government briefings. I haven't been reporting on that story. I've mainly been doing stories in the community. But I like what Dr. Masi and my other colleagues are doing when they go for those briefings, which now is to really ask difficult questions and the tough questions that need to be asked. For example, I remember someone asking the Director General of Health, is that you said that we're going to have 10,000 cases by the end of April. Is that projection still true? What are the numbers? What are you projecting? What is your science telling you? And I think that's how we can deal with the issue of fear.
Allow me to just chip into that issue of balancing. And this is now from the doctor side of me. It is okay to take a break from all the information about coronavirus, because if you look locally, internationally, almost everywhere, everyone is talking about the corona stories, but it doesn't mean that life has stopped. Mothers are still giving birth. They are still having the issues that we've always had. Malaria is still affecting children, and we are getting into a malaria season, for example. Life is still happening. People are still getting accidents, though not as many. The climate is changing. So it is okay to actually look at other stories. It is okay to change focus from everything about the corona stories, because that's the way to remain sober. And if as a journalist you're to maintain that sanity, then once in a week you should look at doing a story that is totally different from the coronavirus, or a story that is not so directly about the hard facts about the corona stories, about the graphs, the projections, I don't know, the monies, the PPAs. Sometimes it's good to just take a break from there and do other stories. Like for me, every Sunday I go to the village and the market, and I just talk to people about life. And that gives me a break. That makes me realize that, after all of these figures and facts and whatnot, life is still happening. Mothers in the market are still worried that, you have not sent them the money with Pesa ya Kutoa, otherwise they'll not give you their phone number. And I find that for me a sobering moment, because every day it's hard hitting everywhere. You're pouring through academic papers, journals, statistics on every day. So once in a while, it's good to take a break away from the coronavirus, especially for journalists. especially for journalists and even for the public. It's good because now it sort of brings you back to reality, because we're just in a phase, in a season, which you will get over at some point. I think, Njoki, you're on mute, I think.
Okay,
Okay,
great.
great.
Thank you so much.
Thank you so much, Dr. Korir, for your insights. We have two questions here from Dr. Hayes Mabuzera. He's asking, this is a very difficult time to be practicing journalism. How are you and your newsrooms navigating social distancing and ensuring your own safety in your reportorial routines? And then second question related to the first, how are journalists and newsrooms coordinating news work via digital technologies when working from home rather than from the newsroom? I think this is a very relevant question. So maybe we can start with Asha, and then we can have Mercy also chime in to that answer. And sorry, Asha, before you answer, there's Benson, my colleague here, is reminding me that there is a poll that has been launched just now. So in one of your icons, you're going to see a poll. Actually, it's just popped up. So kindly, would you be so kind to just give us your insights on that? This is to the audience. Asha, over to you. Please unmute.
Unmute.
Unmute Asha.
She has to unmute herself. Yeah.
Yeah, you need to be unmuting me, saying I can't unmute on this side. Sorry about that. The first question about newsroom safety, I think our newsroom has done really well, considering that this is something very new that we're dealing with. One of the first things that Royal Media Services did was to bring doctors who actually were on the front lines of the Ebola crisis to first come in and train us on safety. So we had a session, especially for the frontline reporters and camera people and drivers, and we were taught just about our own personal safety, our masks, our gloves, and that was one of the first things that we did. And then beyond that, of course, they realized that space was an issue. It's very hard to maintain social distancing in our office. So half of the staff was sent home. So the non-essential staff was no longer coming to the office. And for the essential staff, we were divided into shifts. And the shifts work very well because what they've done is that they've, even for reporters and cameramen, will be in the field for around 7 days, and for the other 7 days will be off. So what that means is, if in the eventuality, and we hope it doesn't happen, that perhaps one person gets infected, then you're able to sort of like put everyone in that shift in quarantine, and work continues in the other shift. I think you've also seen that not very many of us have been going into hospitals, and this cuts across all media houses, and I've noticed that for the TV station, that's because we still can't guarantee our safety, especially in public facilities. We're trying to get access to those places now, and I think now we're more prepared. Everyone is feeling more prepared that we can cover now the front lines really properly. In terms of technology, I remember after doing my first couple of stories, I had a really bad flu, and there was a scare in the newsroom. So I had to work from home, and it was just about adjusting. So exactly how we're doing this Zoom call, I would call my sources and record my Skype conversations with them. I bought a microphone that I started recording my videos from home, and I could very easily do my reports from home, read my scientific articles and talk to experts. So for me, I think we've actually adjusted better than I expected us to.
Okay, thank you, Asha. There is a question here from Emmanuel Yagon from Mobile Journalism. He's saying that there have been a lot of speculations surrounding the numbers issued by the government of Kenya. What are the two doing? That's both of you. What are you doing to get numbers and the faces behind the numbers? I think, Asha, this is to you. How did you get to talk to the person that you interviewed over the weekend? Even as you seek to inform. I also like what Dr. Korir has been doing, questioning even what the Cabinet Secretary for Health has been saying. Is there a way to verify the data being provided by the government of Kenya? I think Dr. Korir would be in a better position to answer this since she has been attending the briefings. So how are you verifying this data?
Well, I think I've now come to believe that any journalist is as good as their sources. So by the time we are going to a press conference and asking those questions, there's a lot of background work that has happened. Think of it like an iceberg. We only see the tip, but there is a lot underneath. So by the time we are asking these questions, by the time we are even writing a story, there's a lot of background work that has happened. There are so many sources that we have talked to. And personally, for me, when I have any piece of information, I make sure that I corroborate it with at least 2 other people so that I have 3 sources that have confirmed the same, because we are in an era where you don't want a story planted, or you don't want to be misled. So I have to corroborate with at least 3 people for any story that I do. So most of the time we are just actually, in my opinion, even keeping the government on track. When they say we have 10,000 PPEs, for example, and then when you do the math according to the capacity and whatnot, you know that that is not true. That's why I can confidently ask the CS what has been happening, such that until now the 10,000 you are talked about are not here, because we know what is being said and what is in the background are totally different. So here you have to have very good sources, you have to have very reliable information, and to read widely and compare a lot. I think over the last 1 month especially, I have read so many scientific journals, I have talked to so many experts, not just locally, but globally, so that the quality of stories that we get is something different. So here, we do a lot of background work to get the data before we ask or we get anything from the government. Now, the challenge with me is that because of the issues that we've had with testing, for example, I've had the privilege of at least going twice to Kemri labs to look at the testing or the processes behind the scenes, even the little details, like for example, like something like virus transport media that they're manufacturing, which is an important component in testing. So my problem is that there is no coordination of the number of labs that are testing. So sort of everyone does their own. So when you want to really get the real numbers, you end up with estimates. This lab will have their own estimates. This other lab will have their own estimates. There's no one with tangible figures. And what that translates to is, I cannot confidently say these are the number of positive cases, for example, or these are the number of negative cases, for example, because the information is so uncoordinated. So I'm thinking from a journalist side, we are getting all this confused and coordinated information. What is happening at the top? And I would like, for the sake of the public and all of us, that it is not the case in what is happening at the top, at the task force level, in terms of the information and the data, particularly now when we're talking about these smaller figures of testing, contacts and contacts traced, the number of positive cases and everything around it. So it's a balance between having very good sources, knowing to sift through information, what is real and what is fake, and now comparing it with what we know is practically possible. Asha, you may have something to add there.
Yeah, I mean, I've had a lot of questions about the numbers. unfortunately, it's the type of story that you can't come out with challenging the numbers that are being given unless you fundamentally have like very good evidence for questioning that. And I think the way that we've questioned, I don't know what people are expecting, perhaps from local media, that we come out and say, look, this is our real number. Unfortunately, we can't do that because we're not testing. So we have to go with official figures for our stories. But what I've seen very many people doing is raising some of the questions. For instance, if you're saying that we're now at more than 200 cases, for government to have closed down counties like Kilifi, Kwale, there might have been reasons for that. And so it's raising questions like, so who are the contacts of the cases in those counties, in Kilifi and Kwale? When you think about very fast that I've had even some of my senior editors asking about what's happening in Mandera. Two people traveled from Mombasa and went all the way to Mandera, and that's a way that people are asking those questions in some of our stories. It is, we have two people who tested positive, traveled to Mombasa, from Kilifi via Mombasa into Nairobi. They went to Eastleigh, stayed in a hotel in Eastleigh, and then went all the way to Mandera. So how well are we tracing our contacts? And I think I have seen very many reports that are questioning the contact tracing, how efficient it is. Beyond that, I think Matthew has said it right, that right now it's actually about our sources, and not just about who your sources are. It's also about how well do your sources trust you. That's something I've realized, because like for my story with the Aga Khan guy, government announced that we have an ICU patient leaving the ward very soon. He's out of danger. I think 5 days ago. That was like maybe 3 or 4 days before I actually got access to the patient. And when they announced this, some of my sources at Aga Khan Hospital told me it's actually someone from our hospital, and I would really like to speak to this person, even on phone if possible. And they went and asked the patient, and they were very uncomfortable because of what happened with patient zero, Brenda, and her first contact, Brian. Just the online cyberbullying. Dr. Matthew spoke about stigma, which is a really big issue right now, because this patient was very willing to come out and tell his story and have his face and identity revealed, because everyone around him actually knows that he's recovered from this disease. But he wasn't willing to have his identity revealed to the public because of the cyberbullying that followed the first two patients. So that's how I got access to this patient. And, when I went to interview him, I found his family members there. They were still very worried about the media attention. I had to talk to them again and just be human in my approach, that he's more than a statistic, to understand that this is someone with a family, this is someone who has gone through something very traumatizing, and for them to just allow you to actually document their story like that, for me was just quite special. But yeah, it's all about sources now, and when people feel like they can trust you to not misrepresent them, to not misrepresent their story, especially in such a sensitive issue like your own health. You can imagine for all of us, if you went through, what is now being termed as a deadly virus all over the world, if you went through something like that, the first place you would go after you've recovered is not to media houses. And for someone to allow you to do that, it must be a matter of trust. It must be a matter of credibility, and someone believing that you will not misrepresent their situation and their feelings about what they've gone through.
Thank you very much, Asha, for those very interesting points. So your comments are coming in thick and fast. So Dr. Washeke Kombe and Joy, I want to believe this is Joy Kibarabara from, she's a PhD student covering, she's studying constructive journalism. And Joy has a very interesting question, which sort of relates to what Washeke Kombe is asking. The coverage seems to be driven by statistics with an emphasis on the dead. What are journalists doing to contextualize these statistics so that the coverage is not skewed so much towards the negative? And not what Dr. Washeke is asking, how are Kenyan journalists preparing to tell this story? International media will want to paint the continent in bad story. I think what both Washeke and Joy are asking is, how are we able to take our narrative and tell it as it is, on this narrative of coronavirus within the context of Kenya. So I think I should shoot that question to Dr. Korir.
Well, I think the coronavirus, in my opinion, has presented a situation where, as not just Kenya, but African journalists, it has presented us with an opportunity to tell our story, to write our own story in our own lens. I remember before we got any cases in Africa, the Western media was like, what is happening in Africa? They are not testing and whatnot. Then now we reported cases and they're like, African countries are not reporting as much as possible. So in my opinion, I think it is a chance for us to tell our story. Yes, we have many issues, the challenges with testing, the corruption therein, and it's not just unique to Kenya, but it's across the African continent. But for me, it's an opportunity to tell our story. And our story here is not just the number of positive cases. It is not just the number of deaths. It is not just the number of recoveries. It is all of them. And that's saying, for me, moving forward, it is an opportunity to start contextualizing the statistics, to start putting names, faces behind these statistics as the next step of this particular storytelling, because it is a process. Yes, we have come a long way, as I indicated earlier. We came from wondering what this is to now it's here, to the measures and what's not. But it is an evolving story. And for me, the next phase is actually now starting to tell, who are these who have recovered? What are the challenges they are facing? Who are these who have died? What are their families going about? Who are these who are positive? What are they going about? What is their life like? Who are in quarantine? Who are the suspected cases? What is their life like? You cannot just focus on one end, like the recoveries only, because deaths will happen. You have to tell that story. People being quarantined, you have to continue telling that story. So for me, it is just a matter of balancing and giving weight to one other, to one or the other of these statistics. The second point, or the second part to look at moving forward, is because you need to give people hope. What is there? What is there ahead in terms of the vaccine, the treatment, or the cures? What are people doing around all of these issues to give some hope to this pandemic that has caused a lot of issues? So it is a balance. As journalists, you cannot only focus on one and leave the other. You have to give a holistic story. And I know we're running out of time, but somebody had asked about audiences. And you realize that, as Asha had said earlier, people thought that the disease was elitist. That's why even now, when I go to the market like I do on Sunday, there's hardly any physical distancing happening. The masks, people have them on their faces, not necessarily knowing what they need to do with them, but wearing them because the government said we wear. So there is a lot, and as journalists now, and for me, where I found myself is I've quickly had to transition to a multimedia journalist, where you do TV because the audience on TV is different. I do radio, both English and Kiswahili, because the audiences are different. I do print because the audiences there are different. Do online because the audiences there are different, so that you communicate the stories according to the needs of that particular group. An elitist group, for example, would want to know what are the statistics, what is the future like, but Mama Mboga wants to know what they'll eat tomorrow. So you have to really think 360 and segment the content depending on the audience and the medium where you're relaying, or the platform in which you're disseminating this information. So we find ourselves in a very interesting time where we quickly have to adapt to being 360, focusing on everything and giving weight where it needs to be given weight depending on the situation that there is. For example, this week I expect that we'll give weight to issues of burial and disposing the humane disposal of human remains post-COVID. That is relevant because we have an incident. Next week, it will be something else. The other week, we had issues of quarantine. Next week, it will be probably healthcare workers, as it keeps evolving. But it doesn't mean we forget the story entirely and focus on one. We have to look at everything holistically, 360. And this is the time to rope in as many journalists as possible. If you can be versatile and do many things, this is the time to actually do that.
Thank you, Mercy. So to the audience, there's a new poll that has just been launched. I promise this is the second and the last poll. But back to Asha. Asha, there are some people who are still having an issue with the fact that you tracked down a coronavirus positive, former coronavirus patient. And Helen Shikanda is asking, is it ethical to talk to patients positive with coronavirus, just to tell a story, just to get a story when they are ailing? And still, this is not related, but Asha, I'd like you to answer this second question from Malimu W, who is saying that Governors Joho and Gilu have received media attention for their efforts to contain the coronavirus pandemic. What do you know about other county responses to this pandemic? What are other counties doing in light of this pandemic? Asha.
Thank you. Just to clarify, the patient that I've interviewed was not positive. This is someone who had left hospital. And we don't interview patients just to get stories. I would have loved, actually I had to go into the office on my day off to do that story. And I would have loved to just stay at home because I had done like a long 7 days in the newsroom. I would have loved to just stay at home and relax like everyone else. But I think these stories are important. Dr. Matthew has said something very important. Everyone is asking about those numbers, these people, give us the faces, the names. We don't want statistics. So who is going to do that? We'll have to do it. We have to tell you this, unfortunately, the tough stories to tell of people who passed on. Who are they? Put a face to them, put a name to them. We also have to tell you, these are the people who are ailing, at least to the best of our ability, and to tell you these are people who've recovered, and this was their experience. The most important thing, I would say, is ethics. One of the things that we have to consider is privacy. So this is a story that people have to be willing to tell themselves. It's a story that you have to do with the utmost respect. So for us in our newsroom, something that our editorial director did is to actually come up with guidelines and circulate it to all of us. And the guidelines, in a nutshell, just guide us on how to approach a story where we've gotten access to a hospital, we've gotten access to patients who are ailing. And one of the things is that you must, if you get that story, you must do it in a way that that person you're interviewing feels most comfortable. For me, the story on Sunday, as you could see, I had to hide the real identity of the person I interviewed because they didn't feel comfortable revealing their identity, as I've explained. So I adhered to all ethical standards. I also have to let you know that for Aga Khan Hospital to allow you to interview a patient while they're being discharged, there's a lot that goes into that. And that's what I've told you, I had to leave my house on my day off to go and film that story because the patient had to consent. They have to sign consent forms, not only from the hospital side, but also from our own newsroom as well. And then we have to sit down with the families and make sure that they're comfortable. And so it's not the type of story that you can chase and say, I'm looking for people to interview. I want to interview someone who is COVID-19 positive. It is that this is such a timely story. Someone is walking out of hospital after being on a ventilator for 11 days. What was their experience? And what does this tell us about what to expect? Because his doctor, Professor Rina Shah at Aga Khan Hospital, said that the worry now is with how many people it took for them to just treat this patient. How many doctors, how many nurses at the ICU unit, how we have to monitor a patient on a ventilator, how much PPE they had to use just to treat this one patient, actually gives us indications of what to expect. when we now ask the next questions of how many ICU isolation wards do we have, we now can quantify and say, look, for this patient who was in the ICU for 2 weeks, this is what was needed to treat them. So supposing we get another 40 such patients, especially in very far-flung counties, what does that mean to us? So we don't interview patients just for the thrill of it. We do it to, you know, to get more answers, to get more clarity, to give people hope. And, you know, when done ethically and when done right, I think they are very important stories to be told.
Okay, thank you so much, Asha. We are going to take a question from one of our colleagues here, Gitonga, who's asking, from the data we have received from the Ministry of Health, it seems the number of children being infected is increasing. It's tremendous. Today alone, 5 children between ages 0 to 14. Do you think there's enough reporting on children? That's to Dr. Mercy Korir. And then Kenny here is asking, as an experienced journalist, in your opinion, what are the best measures to achieve self-isolation and social distancing for people who get their daily sustenance from the streets? So Mercy, are we reporting on children, and how, what would you advise Kenny and other people who get their daily sustenance from the streets?
Okay, when we started this particular pandemic, as a country, we didn't have many children. So I think we started with stories of caution on children. And I remember when WHO, the director, the Africa region director was here, they had a meeting prior to us recording any case. There was a big worry about children, not just in Kenya, but in the African continent, because of issues of malnutrition, because of TB, because of HIV. And so we started from a point of caution. We don't know what will happen. And it's been a long time coming before the government actually started telling us that we had children. And I remember I think the second press briefing I went for the CS is to ask them to give us a breakdown of the age groups so that we are able to know who is it that has been affected by this disease. Is it the same trend that we are seeing in the global north, where it's mainly elderly and not children? Because we could have been saying, you know, these are the numbers, and we don't know what these numbers mean. And as we're seeing now, that we are reporting children, obviously it's a cause for concern, because now we start asking ourselves a lot of questions. And two, it's now a chance for us now, as I said, the story is always evolving, to now put children at the forefront and start reporting about children. How is it that they are getting this disease? I get a lot of question about whether it is transmitted from mother to child. Are we looking at something like we saw with HIV back then, where we started not really knowing that it could be transmitted from mother to child? So it's an evolving story. The other thing is death in children is not common. We are one of the few countries that has reported a death in a child. So also we have to monitor that and know what is the status of these particular children that have been reported to have coronavirus. Are they in critical condition? Is it mild? What is it? Because what is happening in the global north does not necessarily mean it will be replicated here, because our situation, our circumstances is different. So yes, we need to start doing stories of children. I think as a media house, we have done ourselves a story on children and how children are affected by the coronavirus on our various platforms. And so it's probably just time to now shine a spotlight on it. The other question, just remind me what the other question was.
So Kenny was asking, for people who get their daily sustenance from the streets, how do they observe social distancing and protect
so
themselves?
This is a tricky question. It's a delicate balance between getting what you need to eat today. And I remember at the beginning of this pandemic, people were like, I will probably die of hunger and not coronavirus. People have to look for food. And that's why you see many countries have gone to social protection. In the US, they're delivering food in people's homestead, in people's houses. Canada has offered some relief for people, the UK the same. So but we find ourselves in a different situation where people have to make money, people have to eat. So here for me, what I advise people is you need to get something for yourself and your children, but there are measures that you can do. You can wear a mask, you can wash your hands with soap and water at every given opportunity. If you can afford a sanitizer, the better, because it means you can walk around it and sanitize as much as possible. So it's a delicate balance where there's one, the fear of the disease, and two, the fear of hunger. And the immediate concern for people is always, something to eat. So if you can observe all these other measures, then just venture out and look for something for yourself, because well, you cannot live in fear. And it's the same thing that we saw that after the curfew was enforced and police were clobbering people left, right, and center, mothers were afraid to go out to deliver at night. And they were laboring all over the night. In Makueni, we lost 4 mothers because there was a fear of going out and being harassed by the police. So they opted to risk it at home, and unfortunately, they paid with their lives. So here for me, look at the immediate danger and you choose. You'd rather go get clobbered by the police, but you deliver a healthy child and you go back home with your life. But well, we'll still report about it, but it is a delicate balance because we find ourselves in a very unique situation where sometimes common sense is not in all of us, and there is the primal needs of a human being, which is survival. So if you need to survive, please do, but wear a mask as has been advised, keep hygiene as much as possible, and hope for the best.
Okay, thank you so much. First of all, to our audiences, thank you so much for logging in and being part of this wonderful webinar. Special thanks to our guests, Dr. Korir and Asha Mwilu. It was such a great pleasure to host you. We have so many questions, most of which I'm going to send to you on your emails. So if anyone listening has a question that needs to be answered, please send us your email address and your question as well, and we'll forward it to Asha. I need to apologize for being 11 minutes over, but it's because we started a bit late. So thank you so much, everyone, and I officially declare this meeting done. Thank you. Bye-bye.
Thank you.
Thank you.
Thank you, Asha.
Thank you, Josie. Thank you.